Welcome to the Stoke-Mandeville Plastic Surgery series. My name is James K.K. Chan. Thumb reconstruction is one of the greatest challenges facing any hand surgeon. Back in 1976, William Littler, the pioneering American hand surgeon, looked back on 100 years of surgical effort in thumb reconstruction. And then he set out his reconstructive criteria based on this, which are to re-establish an opposable, sensate, and stable thumb of adequate length, and also to consider strength and mobility. Now, of course, to achieve all that is a pretty tall order. And as if that's not enough, a few years later, Wayne Morrison, the great Australian hand surgeon, also added yet another criterion, which is that the thumb should look like a normal thumb aesthetically. After all, the hands are second only to the face in terms of aesthetic importance. So continuing our quest to reconstruct the perfect thumb, I'm delighted to welcome a guest from China, Jane Xiao Fengshen. And Jane is a microsurgeon who specializes in reconstructing kids' hands. She is associate professor and vice chair of the Department of Orthopedics in the Children's Hospital in Soochow University. Now, Soochow is a huge city with over 10 million people on the east coast of China. And Jane has extensive experience in reconstructing some of the most complex congenital and trauma cases. And we're extremely privileged to have her here with us, sharing her experience and her tips, and also to answer some of your questions too. Also with us today is Charles Low, who's a senior plastic surgery registrar in Cambridge. And he himself is an accomplished microsurgeon, having spent 2 years at the Changgung Memorial Hospital in Taiwan as a fellow. Unlike me, he's actually impressively fluent in both Mandarin Chinese and English, and he's very kindly accepted the invitation to come and help us with translation during the Q&A session at the end. Although I can promise you, Jane, that your English is far better than my Mandarin Chinese. So we'll get started very shortly. So if the audience, if you have any questions or comments or anything, please do jot them down in the chat box, and then we'll get to them as soon as we can during the Q&A session. So without further ado, 申医師，謝謝. Oh, you're muted. 聽不到.
Thank you. Thank you, James. Thank you, Charles. Today, I think it's my honor to take a presentation. I begin my presentation, microsurgical thumb reconstruction in pediatric patients. As I am a hand surgeon from China, from Children's Hospital of Soochow University. And today's my presentation. This is the overview and anatomy, my preference techniques from trauma to hand congenital, representation to transfer. Hand congenital separate 3 parts. Complex radial productory secondary correction and some dysplasia. This is my hand, my left hand, and we know that we focus on the thumb reconstructions to consider function, stable bone and mobile joint, and appearance, thumb length and nail. Also, we focus on intrinsic muscles and extrinsic tendons reconstruction and sensation reconstruction. Representation. If kids travel, we think we will try our best to representation for a kid. This is a 5-year-old boy, affluent right thumb avoid. We should avoid bone shortening for future for kids for kids finger representation, preserve physics. This case was did several years ago, and maybe 10 years ago. And after surgeries, after 6 months follow-up, the thumb is looking normal and good function. And if tremor is defect, some defect, so we can use toe transfer. 5-year-old girl, tip of right thumb defect, reconstruction with right big toe, partial nail flap. Donor side reconstruction with VY advancement flap in plant side. Nail bed only partial thickness harvest. Part of nail defect. So we design the part keeps the part nail flap. And we notice these pictures, partial thickness nail bed harvest from big toe after surgeries. This after another surgeries, touch-up reduction surgeries. We notice the nail have a good nail, and the donor side also has a nail bed survive. And part of the big toe, we use the VY flap. So donor side is a good aesthetic. Another 5 years boys some defect. We use the lateral half distal phalange bone physics nail composite flap. And if we look this some his this emphasis of DRP remains. So we keep the emphasis from the big toe part of big toes faces. After the last picture is after 8 months follow-up. And this follow-up function and extend and flex. And dorsal and donor side after flap. I introduce the congenital difference. Congenital difference is my most cases because patients' parents can find me from online, and they can watch the pictures I share in the internet. So like this case, bilateral thumb duplication, and every thumb is smaller. It is smaller than index fingers. So I did use a microsurgery technique, combined on top plastic and combined the BC procedure. So X-rays issues. I used ulnar thumb, and because it's a BC procedure is performed for distal phalanges, and osteotomy is performed at the proximal phalanx. Then after operation 1 year follow-up, this case whole mother contact me. They are very happy, and the baby, the girl was can go to school now. Normal thumb. After surgeries, X-ray. distal phalanx was BC procedure after 1 year. After 1 year follow-up. And if the kids after surgeries in his childhood with another with a secondary deformity, I can use a marked surgery technique to reconstruction. This is a 12-year-old boy presenting the deformed thumb. He had a radioprotectory removed at a local hospital when he was 6 months old, and then a secondary corrective operation when he was 2 years old, but didn't correct. So I did as a free flap from harvest from the big toe. Radio scar on tighter scar on radio side. I removed the radio scar and create deviation. Harvest the bigger toe bone nail composite flap together with iliac crest bone to correct IP joint deviation. This is donor side. Donor side is a flap with part nail. And the nail I use the modified BC procedure, and the donor side we use the Fuchs technique skin graft. And follow up 7 months. Some can obtain good function and cosmetic can side from follow up 7 months. And another congenital difference. This is a middle hand, and I use the under polarization procedure. After 6 months follow up, and this is a picture after X-ray. And some dysplasia. Polarization procedure is a wonderful procedure. So if the parents can agree the procedure, I always give the advice like this. So after 6 months follow up and the X-ray. But in China, Chinese parents wish to keep a 5-digit hand is almost like this Muskin type 3B, and the best procedure may be the polarization. But if the parents want to keep a 5-digit hand, we can use the marked surgery technique to reconstruction. And osteocatenated flap containing a section of second metatarsal, and its distal head was transferred in reversed position to reconstruct carpal metacarpal joint. And this is artery and after surgeries. And this picture is after more than 8 months follow up. And the second stage, tendon transfer of extrinsic tendons to improve the function. This is after function reconstruction. And another case is also used as a free metatarsal flap. Vein and the artery. The second reconstruction is second surgery is hip opposition transfer. And this is a special case, some hyperplasia. And some hyperplasia is often associated with radial artery defects. We can use Doppler-guided analysis of vesicular before surgery. This case is a 5-year-old boy, composite great toe wrap around and second toe bone and joint flap are harvested to reconstruct the thumb. This case was radial artery defects, and first dorsal metatarsal artery is type 3, Jupiter type 3. Graft dorsal artery and dorsal vein anastomosis to under artery. And this case is difficult. I take the 10 hours to finish the operation, and after operation, and after operations functions of some, and his donor side for foot. Thank you, James. Thank you, Charlie. This is my presentation, and this is my new hospital, Suzhou Children's Hospital of Suzhou University. And I also share my cases in Instagram and Facebook RMC. So thank you again.
Thank you very much. I mean, that's an incredible case mix and incredible technical feats. There are quite a few questions that we'd like to ask you, and the audience would like to ask as well. But and we'll go back to some of these cases if that's okay. But can we start off by just asking you what inspired you to go into congenital hand surgery reconstruction? Can you tell us about the pathway? Charles?
沈医生，就第一个问题就是那个您怎么会选择像这种儿童这个重建手术这个手方面手外科？
对我最开始是一个成人手外科的医生，然后我从事就是手外科各种显微外科的一些重建，所以但是我后来对儿童的先天畸形就congenital hand 非常有興趣。開始做 congenital hand 以後呢，我就開始用顯微外科的技術，我覺得這樣會把手術做得更好。然後像一些複雜的，像這個父母畸形，可能對其他醫生來講，他可能就切除一個就結束了。但對我的想法，我就是想把它做成一個更完美的一個拇指，就我的理念是，這個拇指多指的切除，並不是切除多指，而是重建一個正常的拇指。所以就越來越，就每次我會跟患者家長去溝通，就是你們的要求是什麼，你們的想法是什麼，然後我覺得我能做到什麼，就是這樣子一步步把這些手術盡量做得完美一點。
謝謝。So Dr. Shen has just mentioned that she has her background of hand surgery in China, which is separate from orthopedics or plastics and even the specialty itself, and working away from adult hand surgery and reconstruction, of course, which initially encompassed sort of pediatric hand reconstruction, but she gradually found her niche, and she was quite good at it. She got patient feedback from parents and stuff, and gradually she, her ethos is really to try and salvage as much as possible rather than sort of discarding any part. It's more reconstruction, especially with the fact of a thumb, that she tries to try and get as much function possible. And that, just the feedback from her patients, the kids with their parents, they all say that she's done a good job, and that's encouraged her to pursue it further and improve her technique and skill in this area.
It's the power of social media in 21st century medicine. And James, to be congratulated on winning her third best case award on the International Microsurgery Club on Facebook. So congratulations. can we ask Jane about the timing of surgery, particularly with the congenital differences? Can you ask her about that?
实际是这个什么时候是最理想的这个手术的时间呢？对于这些小孩来说，尤其是这种先天性的这种畸形的这个手，什么时候对您来说是最理想的这个手术时间？重建时候？
如果不是做游离的手术，就是单纯的重建1岁左右，都是大部分手術1歲左右。如果是要游離手術，就是需要從足部供區取走哈，我一般是建議5歲。
Oh. Normally, most of the surgery can be performed at about 1 year of age. That's provided that you're not talking about any toe-to-hand transfer. If it's a toe-to-hand, if you're taking any parts from anywhere else, she says about 5 years of age would be ideal for her.
And can she give us an idea about the breakdown of the different kind of her case mix?
那您在您的这个病例当中呢，大部分的是哪几种这个先天性的呢，或者这种 trauma 之类的创伤之类的，重建啊，那种病例是多少？几部分那种？
先天性的居多，因为我 trauma 我就是其他医生做的可能有问题的不会做，需要重建再造的会找我。普通的创傷我不做，因為我可能先天性的病人預約的已經非常非常多，就是以先天性的對。
For now, Dr. Shin's gradually getting more and more niche in her specialty. So I think she mentioned earlier before that the waiting list for her congenital hand reconstruction is about 6 months. So that's mostly what she does. And there are other surgeons to do the trauma bit. So most of her cases now are all congenital based.
Brilliant. Okay. All right. I have a question from an audience member, Ardashir Bahidi. I hope I pronounced his name right. He says, thanks for an amazing presentation. Please let us know about the tourniquet time. And also, what about metatarsal bone defect in the case of the dysplastic thumb? Maybe Jane can share screen again. Can we see the dysplastic thumb again?
止血带是吧？对，是
可能是那个 tourniquet time 对止血带，这时间是大概多少？还是？
因為我們要放鬆，就是1個小時到1個半小時之間。如果是1個半小時可以結束的手術，我會延長到1個半小時。如果我知道今天的手術比較久，肯定是會3、4個小時、5、6個小時，肯定放1個小時就會放鬆到10到15分鐘。
Normally 1 hour to 1.5 hours, but if you know that the surgery is going to take longer for 3 hours, they definitely has to let the tourniquet down, giving her 10 to 15 minutes. She does reinflate it. That's what she meant. Yeah.
Can she share her screen again so we can see that dysplastic thumb?
他们对那个 hypoplastic thumb 的那个重建比较有興趣，尤其那個 joint transfer， 那個你反過來那個，他們對那個有個人就問這個 metacarpal 那個 bone 是怎麼重建，因為您是把那個腳趾那個 metacarpal proximal 的部分反過來吧？
對，倒過來，對，倒過來，在這裡，就是這個遮骨頭會變成那個腕掌關節這裡。了解。
So this is a metatarsal transfer. Dr. Shin saying that if there's a dysplastic, hypoplastic thumb in general, you lack the bone components, the muscle components, of the thumb. And in Chinese kids, the mentality in Chinese not to sort of, policization is a great option. She always goes for it if the parents are agreeable. But in any case, a lot of the cases that the parents are not really keen to have a child lacking one digit. So she has to come up with ways to reconstruct this. And as you mentioned, the lack of a metatarsal bone is an issue. So, and the joint, the CMCJ as well. So what she does here is the metatarsal transfer, but instead of putting it in the way in the foot, you reverse it. You put the proximal end distally for the thumb, and that gives the thumb the length. So that's what she does. And then augments it with opponent's plasties, as you mentioned just now, hubris transfer, FDS.
And what about the donor site? Any problems there without the metatarsal?
您的在这个 case 当中，这个脚趾没有那个 metacarpal 的话 ，metatarsal 的话，会有問題嗎？
是沒有。其實我們重建了這個因為我看這個圖，我們 看这个图，其實這個片子沒有打出來，是用了第3椎骨的一部分再重建到第2椎骨去。就是這個呢，因為這個方法其實是我們跟積水潭的陳尚林主任學習的，然後呢，他那個最後椎骨也能長起來的，就是第3椎骨劈一半，再到第4椎骨去，是這樣的，並沒有讓它缺損。
了解。It's a non-vascularized bone graft from the other side, a hemi sort of the 3rd metatarsal. She uses it to bridge the gap, and then there's sort of regeneration and bone growth later on.
Right. So does she plate on the bone graft? Does she plate it on, or does she kind of wedge it in?
骨头是怎么固定的呢？是用铁片啊？
柯氏针。
Kirschner wire.
Okay.
Wise.
Right. Okay. And just to push a bit more about the metatarsal transfer, that's just the metatarsal. Is she taking the joints with it, or yes, she is, isn't she? Or
这个对，也是有这个关节吧？那个 metatarsal 的关节没有还是？
有这个我关节软组织全部重建的，就是保留这个关节面。
So what, as a hemiarthroplasty or the entire MTP joint?
只是但是那个前面那部分的那个关节有拿吗？那个整个 metatarsal joint 有拿吗？还是只是那个關節面而已？
關節面是椎骨頭，這個是椎骨頭。
Just the metatarsal, but including the joint surface, not including the proximal.
All right. I'll be interested to go back to the final case that she showed, where she took a combined 1st and 2nd toe transfer. The final case.
所以能不能到最後您的那個 case， 最後那個最複雜的那個，你說10個小時的那個？
對，這個。
啊哈。
對。
就是
這個血管的情況。
Yeah. So this one is a very interesting one, and of course, it got a lot of discussion going in Facebook. The question is, why take both toes and not just the big toe to reconstruct that thumb?
就是想問，為什麼會需要拿2個腳趾呢？不只拿這個大腳趾？
對行走的走路來講，共區大腳趾的骨關節、第1椎骨這些呢，是走路共區非常重要的。你骨關節可以拿第2趾，對腳的影響比較小，但是第2趾的外形到手上來講呢，是不太適合，沒有大拇指的外形，所以呢，這樣組合的話呢，對腳的影響會相對小一點。像腳的話，大拇指的骨關節其實是在的，它走路沒有影響，它只是丟了一個第2趾的骨關節，走路沒有影響。對，所以說我們共區保護共區的考慮也是。
So in response to your question, James, why not just the big toe alone? Because the big toe offers a lot of functional in terms of the gait and mobility of the leg, so of the foot. So she tends to keep that, but the 2nd toe can be sacrificed without much of a great functional deficit. However, the soft tissue component of the big toe is more ideal compared to the 2nd toe. Hence, using the skeletal framework of the 2nd toe, you can reconstruct the thumb with the appearance, giving a broader front with the big toe, to reconstruct it to make it more like a thumb, but yet preserving the foot's function and not sacrificing the big toe.
Great. Well, yeah. Okay. Great. The other question was that I've seen on her posts that she has mentioned a few technical modifications on traditional techniques. I wondered if she can share with the audience members what these technical modifications are and why she had to develop these.
所以 James 說，這個您在這個Facebook 上有 po 有一些自己改進的這個一些技術，手術方面，能不能簡單的這個就說一下？是哪一種技術？您說有這個自己的獨自這個改造的方式來改進傳統的那個手術方面。
像之前的話，我們做的那個父母多指就是這一類的手術。 其实這個我有在想寫文章，在隨訪我所有的病人，其實隨訪病人效果都是非常好。就是這個BC procedure 我可以用在任何的一個類型的多指上面，就是任何一種類型，我是指像我們之前就是講就是3型2型這一類的啊，我們會用這一類手術方案。像但很多6型和7型，它的手指的形狀和大小也是各異的。就是它並不是說你切除一個，我始終想把它做成接近正常的一個模子，所以我会把這個結構都打散，就是相當於你有血管神經，你把靜脈動脈都分離好以後，我可以把這個多指的這一部分作為一個組合一樣的積木一樣的這樣打散，然後再組合，到最後來講呢，能夠把一個拇指再分階段，就是掌指關節我用哪一部分，指尖關節用哪一部分，指甲用哪一部分，我就把它組合起来。這個的話，我覺得應該有比較好的顯微技術，可以就比較能夠處理起来，手術皮瓣設計上比較能夠得心應手一點。
謝謝。但是想問一下，你是怎麼選哪一個用哪一個部分，哪一個手指用哪一個部分？
首先它是第一標準就是骨關節，就是2個，你骨關節是哪一個部分是功能性的，那我就選哪個手指的骨關節。比方說你掌指關節用哪一個，指尖關節用哪一個，這是首先考慮的。然后其次是它的一個外形，那它的外形以哪一個為主，然後其他那一個剩下那個就作為一個它的補充，就作為一個主指的補充，把它合起来。像這樣子的話，我覺得我使用的這個手術指針在各種類型上多指我都可以這樣去做，就是不太局限於一種比較簡單的方法去做。
So she thinks of it as, she mentioned this Behel-Coquette method, BC method of reconstructing any of these thumb duplications or anything. She says it's applicable to a lot of cases in her series. It doesn't matter what kind of formation it forms. What she does is, I asked her, how do you, she mentioned because of a microsurgical dissection technique, she can offer to choose, she can mix and match what she likes, from which part of the thumb, which part. The first of all she considers is the function of the thumb, which one provides more of a function, the joint especially. So she keeps that part from that particular appendage. And next would be the appearance, which soft tissue component, which better, the nail, which one looks better. She'll choose which ones and mix and match and make it into one thumb. Which her ultimate goal is to make it look like a thumb. So whichever side provides the best bit, bone, nerve, she's mentioned, nail plate, skin envelope, she chooses whichever bit and just pieces it together, as you can see.
Yeah. Okay, great. So can you tell us more about what happens post-op then? What's her routine in terms of, inpatient stay, secondary procedures, follow-up?
術後方面呢，就他們會通常住院幾天呢？如果是通常經過這種顯微手術的這個重建，或者先天性的重建，然後有一個
是這樣，我如果不吻合血管的重建，就是我比方說像島狀的皮瓣血管保留在上面，我組合的話，也就術後3天就出院了，他不留在醫院裡觀察的，因為血供非常穩定的話，我就讓他出院1個月以後復查，因為把它包得非常好，包紮非常好，1個月小孩子怎麼玩耍都沒關係，然後拆了以後直接就皮瓣就好了。如果是要吻合血管的話，肯定是要術後我要住到2週左右，就完全穩定了再出院。
It depends on whether there was a microsurgical anastomosis involved. If there was a pedicle flap or something that just didn't require any microsurgical anastomosis, 3 days would be fine. And then she wraps it up in a boxing glove and brings them back in about a month in clinic, and everything's all healed up. I think there must have been a dressing appointment before that. And if it's a microsurgical anastomosis for flap or reconstruction, whatever, 2 weeks roughly inpatient stay.
Yeah. And how long does she tend to follow these patients up? I mean, presumably they're coming from huge distances to come and see her. Does she try and follow them up till they're teenagers and post-growth spurts?
通常您会这个跟进对每个病人的这个跟进会是多久的时间呢？尤其是James想说那些省外的那些病人都有时候可能就回不來復診之類。
對， 对我有每个家长的QQ 和微信就联絡方式，他們都有我的私人的聯繫方式，每個家長都有。然後呢，出院以後呢，我會定期給他們發信息，然後我會有做好的一些文件，就是康復指導的文件，我有這個 Word 就全部做好，我發給他們，教他們怎麼用。第一次拆包以後，我先教一遍，後來呢，我還甚至把一些就像那個我給你們看一下，像這種的。像有些圖片嘛，就是像這種藍色背景布，或者都家長發給我的，這個都是家長發給我的。他還有像其他的像有些布，這個是我拍的啊。有些布呢，我是有這種布買了，送給家長，讓他帶回去，讓他按照我的要求定期發照片給我，就是對，就能夠過來是最好，他不能過來的話，我全部是讓他們發照片給我，然後當地醫院去拍片，把片子發給我也可以。我隨訪的話，我都是像這個是家長發給我的，這個也是家長發給我的，就是我讓他們按照我的要求發給我。然後呢，對，像這些呢，這個呢背景布就不是特別好發給我。像這些的病例的話，我會定期發信息，我就問他家長，我說恢復的怎麼樣了？差不多1個月、3個月、6個月或者半年，我都能夠跟進所有的家長，每一個從我2013年開始做先天畸形，每一個孩子的聯繫方式我都有。
Wow. Okay, so it's really cool because since 2013, like James has asked us, how do you follow up these patients, especially, Dr. Shinna, before I mentioned she is #1 on the pediatric hand reconstruction forum for this in China, where the public openly discuss cases. So she's
it's a bit like the kind of ranking they have,
like Doctify or something on UK, one of those, the best. So that's why she was poached to get to go to Suzhou University to be, this thing. So how she manages, she gets patients from all over China, not only Suzhou. So how do you get, she's mentioned all these backgrounds with the one on the right, the one on the left. She gives them a piece of the background and teaches them how to take their own photograph. These are all sent in by the patients. She has all of the contact numbers. They have a certain, like a WhatsApp in China, where she has all the parents' numbers and regularly asks them how the child's doing. So the patient does not really need to come back to see her physically, but she's able to get a lot of information. She has rehab sheets that she teaches them one time and then sends it out to them so that they can do it, and questionnaires as well that the patients follow, that the patients fill in themselves and return it to her. But she does it personally, so she keeps it since 2013 when she started collecting her congenital hand series.
Right. I mean, so that brings me to the next point, which is I'm sure a lot of the audience members want to know what kind of outcome measures that she collects and what, in terms of her goals of reconstruction, can she tell us her list of priorities?
就是James 想说的是，您在重建的这个重要性的当中，您是排列是注重哪一个重建比较重建哪个项目是比较对您来說是比較重要的？
其實功能和外形其實都非常重要，就是當然我第一選擇是骨關節和肌腱的一些支點的重建，就是讓它，但是外形我覺得同樣重要，因為我覺得中國家長的他有個很強烈的就是家長的自卑感，他並不是孩子的，就是他覺得有異常的話，他會對小孩子的心理其實是更多是對家長的心理的，他不能接受。所以我對這個手術的追求，我會跟家長溝通以後，我就問他們想要什麼，就是他們想要一個什麼樣的手，就一般會這樣。比方說我們做拇指發育不良的時候，會選擇四肢母化這樣的一個手術，或者是選擇重建的手術。那我們還是會更多的傾向於就是根據家長的選擇。有些家長他願意四肢母化，有些家長他強烈一定要保5個手指頭，這種的話我們會根據他們的要求來做手術方案的選擇。
So she believes that both appearance and function, cosmetic and functional appearances are very important. She said the culture in China is that the parents always have an innate sense of guilt because of their child being born as such. So, they have to, she has to consider that as well. So she asks, of course, the function is paramount, but cosmetic as well. That's what the parents see and feel about it, feel strongly about it. So as she gave an example earlier on, where if the patient opts for polycization, which is a great option, she would go for that. But yeah, a lot of the times the parents aren't in favor of polycization, and hence it's a sort of meeting of the minds really, in what she wants to, what she can achieve and what the parents expect. Shall I ask about the outcome one?
Please, yeah, if you ask her what outcome
Yeah.
it is.
James 想说这个您是怎么衡量您的这个手术成果呢？就关节这个恢复度啦，或者用什么样的这个调查文件来？
有用的比较多是那个日本的 JSSH 的一个评分表，它有20个项目的，就是每个评分表，然后还有一些指甲的一些美学评分表，同时呢还有就 TED 评分表。这些评分表呢是可能我们会在写文章的时候呢会比较用的比较多。那实际上的话，这个就是还有个家长的满意度非常重要。我觉得家长满意度的话也是评判你手术的一个很重要的一个指标，就是他对这个有多高的要求。然后呢，他是不是没有达到他的一个预期的期望值？所以我现在就是做了这么多年呢，跟家长打交道，我还是把每个手术的术前的跟家长沟通是看成非常重要的，就是能不能达到他的一个满意的一个效果。就虽然我们有些评分表就是从客观来讲，那主观来讲，它有没有效果好不好？然后我觉得最主要，因为我们病人都是来自网络。口碑，所以说这个家长的满意度更重要一点。
那您是怎么对付那些有不满意的家长呢？如果有不满意的这个家长，您会怎么去处理？
几乎现在没有，很少，几乎没有，因为我术前沟通的，因为我们其实我比较特殊，像我这个情况，我的先生也在帮我做沟通，就是我花大量的时间跟他们沟通。就是我把我能做到的效果的比较实际的一些效果，我会告诉他，然后呢，他也会比较，然后他比较以后，如果選擇我手術，我一般不會超過這個手術的一些就術前的一些判斷。然後呢，我也有時候會有冒險的手術，就像那個很複雜的那個膜子重建，就最後一個病例，這個病例家長是猶豫的，他是想做第二組織再造就可以了。但是我覺得第二組織再造的話，你有可能做了這個膜子，孩子也還是不會拿出來用。就是我判斷的話，有可能我還是建議他，你這樣重建的話，有可能更美觀。這個我是做了思想工作的這個病例，就是大部分的情況，我覺得，有些情況可能會有點冒險，但是溝通起來都沒有問題，幾乎好評，100%的好評。
哇，好 ，OK， 謝謝。So I mean, James, she does a lot of the, she has JSSH Japan Society Hand. Some kind of questionnaire, I'm not familiar, but she does that, and they're the objective ones. There's also sort of appearance of the nail bed, the nail appearances is that she does. But a lot of the things she says she focuses on is the satisfaction of the feedback from the parents, achieving the needs of the parents really, and getting them on board and getting them satisfied. I asked her, how do you make sure? What about those parents you can't satisfy? The ones that are not happy. She says, in her experience so far, communication is key, as what we've been taught. And she spends a lot of time getting the communication right with the parents and achieving expectations. She doesn't really doesn't sell them false hope really, but gives them and is able to deliver most importantly. And to date, I think she says that there's all been 100% worth, good reviews, and hence her popularity.
Okay, so we have a question from Ahmed Dia to ask, how old is this talented surgeon? But I think 21 is the answer, but she's been at this since 2013 and has a vast experience. So we'll move on to the more technical side of things. There's a question about whether you use loupes or a microscope. I mean, presumably you're now with these pediatric vessels and you're getting quite distal. the vessel size, we're getting into super microsurgery territory. In other words, less than 0.8 millimeters in diameter.
就分离的时候您是用这个显微手术显微镜呢，还是用那个戴在眼镜上的那个 loop？ 通常 loop 就够了，是吧？还是
对 loop， 除非有吻合血管，对。
Unless it's an anastomosis.
Or anastomosis, so she
No, anastomosis is the microscope, she says. Loops right. For dissection. Loops for dissection, yeah.
Right, I thought she was saying anastomosis under the loops. Okay, and generally, what size vessels are we talking about? They're probably some millimeters, is that right?
通常这些血管大概的这个直径是多大呢？要做这个血管吻合的时候，少于1个 millimeter 0.8。
0.5左右。
0.5。
最细的有可能对我最细可以吻合到0.3、0.5，因为我也有尺，对，有尺子也量过。我做小孩的那个创伤的这个小孩，6岁孩子还是几岁孩子的一个指尖一个确诊做有再造，我都是就是切一点点，就是主指那个供区也切一点点，到脚上到手上也切缝吻合，然后指腹静脉有时候吻合的指腹静脉也是就是指腹上一点点，因为我这个是归功于实际上因为我之前做创伤的时候，对于每个断指再指我都不放棄的，对。指尖的一点点的我都不放棄，我都想把它再指回去。
So 0.3 to 0.5 normally, but she gets this training from her trauma days where she doesn't discard any bit, you know. So even she mentioned the pulp, the little bits of the pulp that she used to join them up. So that's where the practice comes from, and you know, not discarding any bit, and that's how she got good really.
And typically, what size sutures is she using?
通常线的那个直径呢是11厘的12个厘，通常
11厘的是强生的。
And what would be interesting to a lot of the audience is how do you talked about developing skills through your trauma experience and not discarding things. Do you do anything to on a day-to-day basis to keep up with those skills, or how do you advise people who want to do this kind of thing to develop this set of skills?
就是您想说的话，您是怎么训练成他们就知道您做创伤的时候就不放棄每一个部分嘛？但是如果对大庭广众想当您这种医生的这种专业的话，怎么训练成这个进度？
这个就是大量的手术。没有是大量的手术。
Do a lot of surgeries.
对
，do a lot of surgery.
我非常喜歡，我自己非常喜歡。我就是最開始做的時候，我非常喜歡做的手術。我最長的時候，其實值班下來1天1夜呢，堅持就是20幾個小時，一直在手術台上，中間就下來喝水，吃一點東西。最長的時候就是還比較年輕的時候，那個時候。
So when you're younger, she says she's always loved operating, and 20 hours at once of surgery is not a problem. 有什麼這個動物模式呢？用雞腿縫合還是什麼？有這種？
有縫過大鼠，有縫過大鼠的尾動脈，有縫過。
Hill rats.
So she practiced on rats when she was training.
對。
你有訓練過嗎？這個
有訓練過。
有 Yeah, she did. Rat tail. That's 0.8, isn't it, or something? That's
yeah. The tail vein. Then.
Okay. The tail vein, yeah.
Great, brilliant. Okay, and for the anastomosis of these small vessels, do you use heparin or any kind of coagulation regime?
有这个止血的凝固的那个止液剂呢？有用那种 heparin 呢？有打那个讓血稀疏。抗凝藥物。有。
抗凝藥物嗎？你講的是？
抗凝構藥，對，你有用嗎？
有用。
是多少呢？是術後打嗎？
術後打肝素嘛，肝素和那個用罌粟鹼的罌粟鹼藥物術後用。
She does postoperatively heparin.
Okay, but not during the anastomosis or just before.
手術當中呢，有用嗎？還是？
手術當中有沖洗的，有就是你直接
Just to wash the lumen.
對。 这冲洗管壁有。
But not systemically.
Not systemically.
No.
All right. We have a question from Ardashir Fahidi again, and he asks if she has ever had any failures and how she would define and categorize the rate of complications, and how does she do this?
有人想问一下这个，有失败过吗？如果对您来说有这个一个不成功的手术是什么样的？你怎么会去？
我在做成人的母夹瓣的时候呢，有一个末节曾经失败过，就是成人的母夹瓣的时候，但是做小孩子以后，我一个都没有失败过，小孩子的皮瓣和再造一个都没有失败过。但是之前的话，我对有血管微象我会积极探查，一般的话就是术后，我甚至帮一个同事，就是我一个手下的一个医生做的端子摘脂，他当时做了双手的端子摘脂，有8个手指，后来出现就有4个出现微象，后来第4天星期天受的伤，礼拜4还有就是发紫发黑。我们还是没有放弃去探查血管移植，做到晚上半夜凌晨2点，血管移植以后3个手指头救回来了。就是很多情况下我都会就是能夠探查，也把它探查回來。就是我現在的話，我自己做那些孩子特別小的話，我血管圖自己吻合的話，基本上沒有出現問題。因為整體來講，這個風險其實會有很大的風險。一旦出現問題的話，後果很嚴重。特別是先天畸形的孩子，他的供血都是好的。創傷的話，相對來講也好一點。做創傷可以有一定的容錯率吧，可能就是我覺得。
了解。那您是我先說一下，she mentioned that in trauma, I mean when she used to do trauma and sort of taught a hand for that in adults, there was a failure, but in kids she doesn't, but she hasn't had one so far. But it's quite intensive, her monitoring regime, and there's very low threshold to take patients back if need be. And she mentioned a case of a trauma case where there were 8 digits amputated, and someone else replanted it, but 4 of them started showing some sort of sign of venous compromise or something. And she just took it back and helped salvage it with vein grafts and stuff, and they just don't give up, and they managed to save another 3 more. So I think what she's trying to say that the tolerance, she says, also mentioned in trauma, there's a greater tolerance for failure in terms of, because they're already damaged, the hands already suffered a degree of trauma, and, failure is not, it's not to say out of remit, but in kids, in these kind of hands, you're offering a procedure, and failure is not really an option.
Okay. And so in terms of the post-op monitoring then, does she use an implantable Doppler, or does she, what's her monitoring regime, and what's the take-back rate?
術後觀察呢是怎樣？就是你如果是尤其是這些小孩，你怎麼會去固定，會去照顧這些，尤其是顯微手術之後，他們不亂動啊，不去壓他，然後
他孩子都沒有進監護室，就是在就是普通的病房裡面的這個觀察，就是相對來講，孩子我們石膏打好的話，然後術後有鎮痛棒，孩子的只要沒有疼痛刺激的話，我們覺得還是比較好。我不換藥，1個星期不換藥，就是1個星期不去刺激他。每天的話，相對來講，沒有疼痛刺激，沒有傷口因為敷料出血而去換藥的刺激，孩子都比較平穩的。
OK， 然後這個您這個如果要重開的話，要去拯救那個血管吻合的地方，是那個幾率是多少？在您的手中需要把這個病人把這個小孩重新再開一次去看那個吻合的地方嗎？
這個幾率是不高的，對，如果出現這不高，出現有微象的話，探查就像我剛才做的那些病例啊，都沒有探查的，就是在游離手術都沒有探查的。我會探查的可能是我們團隊的其他醫生做的一些創傷的手術，就是不是我主刀的手術，有可能會去探查。但是我覺得這個探查的這個過程呢，會讓你知道哪裡出問題了，然後呢，讓你下次自己做的時候盡量去避免。比如說要把裡面的血管 血管一定要理順，就是不要在裡面有环形的卡壓，在血管壁的地方呢不要有出血，像这些止血，每个血管的话，我在显微鏡下分叉點的話，這些小的分支都在顯微鏡下用那個10個零的線、9個零線給它分扎好，就是結紮好，不要，我覺得血管壁下面出血很容易造成血管的一個卡壓，像這些探查經驗會讓你下次自己會做得更仔細一點。
So it's very interesting because for herself, she hasn't had any takebacks, but in trauma, in other doctors, yes. But what she does is, you learn from experiences and stuff, and all these why anastomoses fail, and the insets are paramount and very important. And she mentions that she's got to lay it proper. There are no kinks. Make sure there's no the most important. She says she has a lot of experience in formation of hematomas and stuff like that. She uses 10-0-9-0 to tie off, to ligate off branches, rather than to meticulously attention to hemostasis really. And she leaves it in a cast for about a week without touching it. If there's no problem and the child pain free, shouldn't be an issue if you don't disturb the anastomosis, in her experience. So
I mean that is incredible that she's never had to take.
I think she's had lots of, yeah.
The one more technical question is, does she tend to do one vein or two veins? Because
for what, the toe hand or the
不止一個靜脈，都不止一個靜脈，都是至少2根靜脈。我從拇指到手指重建的話呢，我再講一個細節，就是我從供區取下來以後呢，它會有些軟組織，比方說脂肪在血管壁的地方，我都是在顯微鏡下先理一遍，把脂肪剔掉，把血管一根根的理清楚，就讓它地部的組織比較不要臃腫，這樣子它穿過隧道的時候呢，它裡面的話就是不容易卡壓嘛，我都把血管理好。對，靜脈都要有2根的靜脈，基本上。
靜脈也會理嗎？如果是非常會 OK。
我就理好了再分。
Minimum of 2 veins really, and she's always preparing the vessels, as we always do. But she makes particular attention to remove all the soft tissue, fat, and to create some space around the anastomosis, so there's no external compression in the vein or the artery, in her experience. So, yeah, meticulous attention and minimum of 2 veins.
Okay. Wow. Okay. So, final question then. What's next? She's pushed the boundaries so much now.
Yeah.
What's the next thing she wants to be able to achieve and conquer, or
接下来您的这个目標是什麼呢？就能達到這個境界了。就接下來的這個，您說這個還有什麼這個還沒探討的地方，或者什麼指定要？
其實這個缺脂的患兒非常非常多。我現在有一個微信的群。全部是短指缺脂的，有100多個患兒家長在裡面。然後呢，他們缺的程度不一樣，缺的程度不一樣呢是什麼程度呢？我可以放在這邊看一下給大家，可以給大家看一下嗎？來，有時間嗎？可能沒時間。我覺得我有時間，我可以這些
a lot of missing digits.
非常非常多。
A group in WeChat of parents with children with missing bits. You just wanted to show.
So that's a big waiting list for her to.
Yeah, I think so. She was just trying to show us the group.
WeChat.
WeChat, okay.
WeChat. 有看到我這個界面嗎？這個有的，就是我全部是患者群，我這個缺脂短指的群全部是這個 group 全部是那個需要再造的這一類的孩子，然後這個是我多指的拇指發育不良，就蘇丹的 IBS 的群 ，cleft hand， 然後Poland， 然後病指的，然後 apt favors， 然後就是這些像這種類型的孩子。非常非常多，目前來講，就是因為只有2個方法，一個方法就是那個不帶血印的指骨移植，然後一個方法呢就是第二組織移植再造，所以我覺得還是有很大 很大的有種責任，我不知道现在怎麼講，並不是說做一些手術，然後他這些孩子，能夠在一起交流的話呢，其實家長都非常非常焦慮，他們很擔心孩子以後出社會以後，因為中國的環境氛圍可能沒有像歐美的這樣子寬容一點，所以對，所以這個情況，我覺得目前來講啊，你能做到什麼樣呢？要盡到做到什麼樣，能夠改善一點功能呢？還是不知道現在3D 打印這個生物打印技術到底國外發展的怎麼樣？我也很想了解一下，就是 3D 打印技術能夠給他們的指骨，就是不需要從足趾移植，用打印的技術這樣子能夠有沒有突破的？
She'd like to look. I mean, she mentioned this group is massive with lots of children with hand defects and stuff like that require bone. And her main point was, you could either do vascularized or non-vascularized bone to build up the thumb. She's hoping, she wondered whether there was some other 3D printing alternative or tissue engineering, that kind of direction, whether, you could, to rebuild a bone without using your own, without sacrificing the toe.
Yeah. Okay, so some kind of 3D printed osseointegrated implant.
Something like that, yeah.
Yeah. Brilliant. Okay, well, that's fascinating. Just wanted to ask on behalf of many audience members, they'll be very interested in your observership and fellowship. First of all, do they need to, can they get by with English, and how long is that period for if they wanted to come and visit?
如果有一些外国医生要过来您那儿去参观去学习的话，通常是这个是能行的吗？如果
可以，非常非常欢迎。
He welcomes everyone. 是多久呢？要有一个固定的时间呢，還是？其
實沒有，都可以，因為我現在剛剛去的這醫院的我們的院長領導非常支持我的工作，非常支持他國際交流啊，國際就是我走出去或者朋友們過來都非常，而且醫院還提供獎學金。
The Suzhou University Hospital is very welcoming and supportive of her, and they provide even a scholarship for some financial support. It doesn't require for anybody who wants to come and visit, learn, exchange ideas, it doesn't have to be any specific time or time frame or minimum time required.
我医院提供住宿。
Yeah, and there's accommodation. 如果他們只會講英文呢，就
可以的。我們其實有同事也有英語比較好的，其實我的英語算差的。
很好啊。Okay.
Yeah, there's people you get by with English or something.
They'll be able to get by.
Yeah,
okay,
well,
that's the main thing.
Yeah.
Okay, well, look, we've got to wrap up. It's just over an hour, so. Jane, thank you so much. I mean, it's been an incredible presentation. Many of the audience members have praised how good it was and how inspiring it was. We saw how powerful microsurgery is in reconstructing the thumb. And, a lot of these kids are so young, they have their entire lives ahead of them. So, you're clearly making a huge difference in their lives too. And it's very nice always to see how you can push the boundaries of our specialty. So thank you so much once again, and we look forward to seeing you soon.
Thank you.
Thank you, everybody. Take care. Bye-bye.
Bye-bye.
Bye.